Hi there, it's Dr. Desai, and we're going to be talking about different types of sedation for our procedures. So when we do procedures, there's a few different types of sedation that we can do, or a few different ways that we can make the procedure more comfortable and reduce pain. Obviously, there's the first type is without any sedation. So that doesn't mean without anesthetic, or that we're just going to poke you with the needle and do the procedure. But this is with an anesthetic or local anesthetic. So we use lidocaine or a combination of short-acting and long-acting anesthetic that we apply locally. And so we'd clean the skin, we'd inject you, sting and burn for just a brief moment. But then after that, the numbing both in the skin and the soft tissues would be in effect, and the injection should be relatively painless. There are some procedures that require a little bit more than that, and that's when we get into the oral sedation. So that's the next level. So local anesthetic, then level 2 would be oral sedation. And oftentimes we'll give you some medicines such as a Versed. It's an anxiolytic, or reduces anxiety. It also is an amnestic, so you can't remember the procedure. So that helps with decreasing anxiety, which is closely correlated to pain, and also you don't remember it, so that's some benefit. And in addition to that, we would give the patient some pain medicine. So something like a Percocet or oxycodone or hydrocodone to layer on top of that. So both reducing anxiety, kind of forgetting about the procedure, or not caring about the procedure, and then also reducing pain levels. With that, you're also using the local anesthetic in combination. So we always use local. The third or most involved or most aggressive type of sedation is IV sedation. So intravenous, that's what IV stands for. And that's when we place a small needle into the vein, which is hooked up to a catheter, and we're able to control the medication dosage. So when we're doing that, medicine is pushed through a syringe, through the IV, gets into your system, and then allows for an immediate control of pain and anxiety, and also consciousness. And so there's a few different types of medications that we use, and those will be discussed with the patient and also with our nurse anesthetist. Often, kind of the older school way of doing that would be with Versed, which the medication that we've given orally, or Valium, and that's going to be an anxiolytic and an amnestic. And then we'd give fentanyl, which is a powerful opiate, for pain control. So those are the two. The second way, oftentimes we use some of that medication and/or in standalone, would be a Propofol. So the Propofol is a powerful sedative and also controls pain and reduces the level of consciousness significantly. And so that's something that we also use, and we found with our larger or more invasive procedures, such as stem cell procedures for the spine, which can be uncomfortable if done without any anesthetic or pain control. We use that and find that to be very, very effective. In addition to that, we're also treating locally with anesthetic. So there's multiple ways of treating. So if you look at the spectrum, it'd be local anesthetic, just the needle, and using the anesthetic through the needle to numb the tissues that we're traversing. Number 2, an oral sedative, where we're using a combination of medicines to reduce anxiety and control pain. And then finally, the highest level would be the IV sedation, that we're giving medicines through the IV and allowing the decrease in consciousness, as well as pain control. One of the other things that we want to make clear is that we're not doing a general anesthesia. So when you hear of that would be where you're in a hospital or a surgery center. If they're doing a major operation or procedure and they're using general anesthesia, then they're actually breathing for you. So the patient's intubated, the anesthesiologist is involved, the machines that are breathing and pumping fluids. We do not need that level of anesthesia for any of our procedures.